Yo, what's up guys? Today we are reacting to this video which talks about the French healthcare compared to the United States healthcare. So, first question, are you guys happy with your healthcare system? If you're watching from the United States, let me know why. I don't think you have a healthcare system, do you? I don't know. But you don't have free healthcare, that's what I mean. I think. I don't know. Correct me if I'm wrong. And if you're watching from France, let me know how your healthcare system is in the comments down below. If you're watching from anywhere else, Norway, Sweden, for example, let me know what your healthcare looks like. And if you're watching from the UK, let me know as well. And I always ask myself, like, why doesn't the US have free healthcare? Not sure, but we're gonna find out. Okay, let's take a look at this video.
Healthcare is becoming a big issue in the 2020 elections. The Democrats are pushing for a government-funded model, while President Trump is campaigning on gutting Obamacare.
We repealed the core of the disastrous Obamacare. The individual mandate is now gone.
Medicare for All has become a mantra among left-of-center Democrats in the presidential race.
Are you guys happy with Obamacare? Like, what would the reason be to, gut it?
Healthcare is a human right, not a privilege.
I strongly believe that we need to have Medicare for all.
I am a strong supporter of Medicare for all.
The candidates do have different interpretations of what Medicare for All actually looks like in America. Those differences aside, it's essentially a universal single-payer system, closely modeled after Canada's healthcare system. But there's another national healthcare system that gets a lot of attention: France. Back in 2000, the World Health Organization ranked it as the best national healthcare system in the world.
Really? I would think Norway or Sweden or, I don't know, I don't know, France had the best medical healthcare system. Let's find out why.
A lot has happened since then, but France's healthcare system remains a model for universal coverage. Here's why. Despite spending less on coverage, France has comparable or even better healthcare outcomes than the United States. The United States has a higher rate of infant mortality. In France, nearly 4 children die out of every 1,000 live births. In the US, that number is closer to 6. France also has a higher average life expectancy than the United States by 4 years. And the rate of rehospitalization in France is 5.3% lower than that of the United States. Lower rates of rehospitalization in France are likely due to better access to primary care, as well as longer average stays in the hospital.
Oh, the French are killing it. Or rather, should I say, they're saving lives. What am I saying?
France gives every citizen coverage from birth.
That is nice.
The system allows them to get more preventative treatments throughout their lifetimes, which save on costs and improve outcomes.
Yeah, this is something, sorry I'm pausing the video too much, but this is something that I never understood here in the UK. Like, preventive medicine isn't really the main core here in the UK, because every time I go to the doctors, they don't try to prevent anything. They just literally, like, I've been to the ER I think twice or maybe 3 times, and they kept me waiting for like hours, and then after like at least 4 to 5 hours, they looked at me and they said, no, just go home and take a paracetamol, and they don't look into it. Another thing was, I was trying to like schedule something in the GP, which is the general practitioner, the family doctor, and they would ask me a lot of questions, and if I gave the wrong answer, they wouldn't go through with any of the exams. Literally, I think it was last year, my wife talked to a doctor. We were asking for like checkups, and they said, oh, you're too young for a checkup. And I was like, my wife was like, what? How is that even possible? But preventive medicine isn't the core idea here in the UK, from what I have experienced, because they only treat something if it's actually bad. Like, we were trying to get an endoscopy, for example, and they said does your stomach hurt? Oh no, it stopped hurting now after like 4 months trying to schedule something, and then they're like, okay, so you don't need it anymore because it's not hurting. I'm like, bro, why? If you say the wrong thing, they will cancel your exams, because, you know, they only treat something if you're going through that pain and suffering. Anyways, what is your experience with the UK health system?
After World War II, French politicians were concerned the country's private healthcare system would not be able to handle coverage demands. So the country established a model of national health insurance, meant to protect the population against increasing healthcare costs. The French call their system social security, but it is not an example of socialized medicine. It's not government-run, just government-financed. It's very close to being a single-payer healthcare system.
I'm Pierre-Yves Loffard. I'm a professor of economics at the Paris School of Economics. Every individual who lives in France, whether he or she is a foreigner or a French citizen, is covered by basic social security. Everyone has access to care. Doesn't mean free access to care, but access to care with reasonable copay.
Oh, it's not free.
This mandatory coverage doesn't come at the expense of freedom of choice in medical care. The system is set up to ensure that doctors are not restricted when making medical decisions.
The system covers every doctor, every lab, every hospital, every clinic. They're all covered, and they all have to take the patients.
That's T.R. Reid, author of the book The Healing of America. He traveled the world exploring different healthcare systems and how well they worked.
America's the only place where we have what the insurance companies call narrow networks, where they dictate which doctors you can go to. No other country does that. In every other country, the patient picks the doctor and the system pays. That's also true for our Medicare system. Medicare covers all doctors. So here's what happens in the United States. Let's say somebody, you know, a clerk in 7-Eleven or hotel maid has no insurance or very little insurance, and she feels a vague pain on the right side of her abdomen. It would cost her $120 to go to the doctor. She's not going to do that. She's going to work through it. And 3 months later, she's in the emergency room, burst appendix. It costs $60,000.
Oh my goodness.
And we'll treat her. But if she could have gone to the doctor when she felt that first pain, the doc could have treated the infection. It would have cost $100 instead of $30,000. The way we do it, by definition, makes things much more expensive because covering everybody so that people get the care they need when it's still early and cheap is a much smarter and a much less expensive way to provide healthcare.
Yeah, I mean, preventive medicine is the best way to go, because if you can avoid something and if you can find it early, then, you know, it will really save costs, and it will save, you know, pain and suffering, and, you know, prevent a lot of diseases and possibly death. Like, I try to get my checkup every year. In my country, that's normal for you to every year get your blood done, you know, check up, like go through a battery of exams, like a whole list of exams. Literally, you get there like at 6:30 in the morning, and you only leave after 1 or 2 p.m. You literally do every single exercise and exam and blood test. You know, you run on the treadmill, like literally you do that, and it's a full checkup, and every year. But here it seems like this is non-existent, and if I would go to like a private sector, it would cost me a fortune to do all of those exams. So in Brazil we have that, which is actually like a health insurance plan that you pay privately, and it also, in Brazil you have both. You have the private sector and the public, you know, so you can go in the public, but it's going to take so long, and it's free healthcare, but it's going to take so long. But if you pay for health insurance, then they also have a list of doctors you can go to. It's not, you can't go to any doctors, but there's like a list of doctors you can go to, but they do every single thing that you need, and it's paid by the health insurance company. But then again, like, that's the thing about Brazil. You don't always pay it. The people who actually pay it is your employer. In fact, in Brazil, they pay for your food, they pay for your transport, they pay for your health insurance. The employer is the one who pays for these benefits. Like every single person has that benefit. And like if you're unemployed, like you got fired, you have a lot of government incentives, including like free transportation for the next 6 months. You get a lot of stuff. You know, Brazil has a very sound and interesting system when it comes to work, you know, and like the employer is the one who pays all the bills, which is absolutely insane if you think about it. But it's the best place to work, I would say. And if you had to pay everything by yourself out of pocket in Brazil, everything is so expensive. So I'm glad that the employers pay for it.
Social Security reimburses around 70 to 80% of medical costs, leaving the remaining amount for patients to pay out of pocket. France also has voluntary supplemental health insurance provided by private insurance companies.
But in France, they want you to know that you're getting something of value from the healthcare system, so they make you pay, and then everybody in France gets about 80% of it back from the insurance company.
Okay, my question is, if you don't have the money to pay, if you really don't have the money, what happens then? Like, you don't have the money because you need to pay something to get it reimbursed, right? But what if you don't have access to the funds? What happens then?
Social Security also legally requires price transparency. And because the government-funded system covers the entire population, it has more bargaining power to keep the prices low. Social Security also has no waiting list for specialized hospital treatments.
Really?
There's also no physician gatekeeping. French patients do not need their general practitioner to sign off so they can see a specialist.
That's nice.
So how does France's system stack up against America's? The French healthcare system is considered one of the most expensive in the world, and yet it's still half the cost of America's. In 2017, U.S. spending added up to $10,200 per capita.
Wait, it's the most expensive, or one of the most expensive, but still half?
In France, it was only $4,900. Administrative costs are also much lower in France than in the United States.
In France, they're limited to 5.5% of the bill. Whatever the bill is, the administrative fee can't be more than 5.5%. In America, our private insurance companies have administrative costs of 20% on every bill. And that's so important to our insurance industry that their lobbyists wrote that into Obamacare, that they're allowed to add 20% administrative costs.
One of the ways the French keep their administrative costs lower is with the carte vitale, a health insurance card carried by every French citizen. When a person visits a doctor in France, they present their carte vitale so the doctor can look them up in the digital system. The card gives the doctor all the information they need to charge for the visit. French citizens can also opt to have all their medical records stored on a card for doctors to access. And because the system is available all over the country, it saves time and money. Another way France manages rising healthcare costs is by having the government regulate them. Unlike the United States, where legislatures are deadlocked on what to do about healthcare, the French parliament votes to set new healthcare budgets and guidelines every year.
The parliament votes every year on, called an objective, but it's kind of binding. The objective national de dépenses d'assurance maladie, so the national objective for social security expenditures, and everything, and all expenditures have to stay in that budget. Of course, they don't always do, but still it's a very effective way to control costs.
But France's healthcare system is not perfect. French citizens pay significantly more income tax than Americans in order to cover government-funded programs such as Social Security. Many French employers say high taxes do restrict them from hiring more people.
People are very happy to pay nothing out of pocket. They don't always realize that on average they pay about 3,000 euros per year.
But the United States' lower tax bite is countered by the fact that Americans end up paying more in premiums and out-of-pocket expenses each time they require medical care. Additionally, doctors in France make less money than those in the United States. French general practitioners make on average nearly $112,000 a year.
That's
in America,
actually really
a general
high.
practitioner can expect to make around $218,000.
Oh,
This gap in wages, however, does not factor in the cost of becoming a doctor in each country. American doctors must take on the cost of medical school, while French doctors receive that education free. American doctors also
What?
must pay for malpractice insurance, whereas such lawsuits are not a big issue in France. A common complaint in France is that certain areas do not have as much access to healthcare as others. However, France has more doctors per resident than the United States does.
bro, let me ask you a question. What if you, American, go to France, study medicine, can't you transfer the points back to the United States and, I don't know, do an adjustment course or something like that? I would assume that would be much cheaper. But then again, you would need to find like a French. Oh, okay. I think you would need to speak French and become a French citizen. Okay, that's not like the best plan.
Every 1,000 residents, France has 3.4 doctors, whereas the United States only has 2.6. Some French hospitals are also struggling with the rising cost.
How do you even calculate that? 2.6 doctors, like 3.4, like what is a fourth of a person, right?
France has 3.4 doctors, whereas the United States only has 2.6. Some French hospitals are also struggling with the rising costs to care for patients.
The fact that budgets are very tight generates lots of tension. So hospitals are under lots of pressure right now.
So what can the United States learn from the French system? France's Social Security proves it's possible to cover every citizen without a government-run system regulating choice and how doctors practice medicine. It also shows that universal healthcare coverage can coexist with private insurance.
Basically, France has really done it right. As the World Health Organization said, very good health outcomes. Everybody's covered, all their citizens, all their alien workers, tourists, and half our costs. So I think they're doing a lot of things right.
Okay, that is a very interesting video, and I think, guys, it's a very delicate situation because I think every country has a different system, and the United States depend heavily on the premiums, I guess, to, finance the whole industry. I think the pharmaceutical industry and the health industry in the United States is one of the biggest, economies of the biggest, like, industry that drives the economy. And that is something sad, actually, because it depends on people's health. And some people don't have the money to, pay for, like, these treatments and surgery and stuff like that. But what do you guys think about this whole situation? And are you guys content or happy with how the system is in the United States? Would you do it any differently? What are your thoughts? And do you agree that they could model the French system? I personally think that like every country should try to borrow the best of each other. So I think the president's main role should be going to other countries, seeing what they have, and trying to implement in their country. Because if we borrow the best of every country, then hey, learning from others, implementing those things, and making sure it works in our country, I think that will make it better for everyone. I do believe in free healthcare, but then again, somebody needs to pay the bill, right? And taxes will go up, and I don't know. I find the taxes in the US like already high, so it's a really complicated situation, and I don't know much about politics, and I don't know much about like how these things could change. I'm just very curious, and you know, you guys may know a lot more than I do, so leave it in the comments, and I'll see you in the next video. Thank you guys for watching. Take care now. Bye bye. Now you can get full access to exclusive content, special reactions to shows, series, anime, full movies, and even request a video of your choice. Just become a YouTube member or join Buy Me a Coffee today. Find out more, the link is in the description.
Never break, always fight, never quit, do it right, play the game.